Hello, my name is Dr. Eroja. In this NAC OSCE tutorial, I'll be discussing carpal tunnel syndrome. I will begin this presentation with an overview of carpal tunnel syndrome. Carpal tunnel syndrome is caused by pressure on the median nerve as it passes through the carpal tunnel. This condition is commoner in women. Factors that may increase the risk of damage to the median nerve within the carpal tunnel include conditions like diabetes, joint or bone disease, for example, rheumatoid arthritis, obesity, fluid retention as seen in pregnancy, thyroid disorders, workplace factors such as repetitive wrist flexing or use of vibratory tools. Symptoms of carpal tunnel syndrome include pain, weakness, numbness, tingling in the thumb, index finger, and middle finger. A scenario that may be presented may be to do a history and physical examination and discuss investigations and management of a 55-year-old woman with hand pain. During the pre-encounter, you need to understand the expectations for this station, organize your thoughts, and think of possible differentials. The next thing to do is to grade the patient, introduce yourself, and clarify the patient's name and age. Also ask the patient how she would like to be addressed. Ask the patient the reason for the visit to the clinic that day and establish a plan for the visit. For the history taken, the patient's chief complaint is hand pain, so you want to find out more about this hand pain. You want to know about the onset. Was it sudden or gradual? What was the patient doing when the pain first started? About the cause of the pain, you want to know whether it's continuous or intermittent. If the patient says it's intermittent, you want to know about the frequency. How often does the patient have this pain? You want to also ask about the duration of the pain. And the next thing to do is to characterize this pain. You want to know the position of the pain, the quality of the pain, whether it radiates to any part of the body, the severity of the pain, whether it's increasing in severity or reducing, also the timing of the pain. Is there any variation with the time of the day? Does it wake the patient up at night? What worsens or improves the pain? Are there any associated symptoms, such as numbness, tingling sensations, weakness, swelling, or shock-like sensations? What about the other hand? Does the patient have similar symptoms? You want to know about the impact of this pain on the patient's work and daily activities, such as typing, driving, or holding a phone. You want to find out about red flags. Ask about constitutional symptoms, such as fever, weight loss, and night sweats. You also want to ask about risk factors, such as history of trauma, history of diabetes, history of thyroid disease, particularly asking about symptoms of hypothyroidism. You want to find out from the patient whether the patient has a history of autoimmune disease such as rheumatoid arthritis, and also to clarify from the patient whether she is currently pregnant. We also want to rule out other possible causes of the hand pain. Next, you need to ask about the past medical history. Any allergies? Is the patient on any medication, such as prescription medications, over-the-counter medications, supplements, or herbs? You want to find out whether the patient has any history of diabetes, hypertension, heart attack, stroke, or cancer. And is there any particular disease that runs in the family? You want to ask about the patient's last menstrual period and any history of hospitalizations or procedures. Next, you need to take a social history. How does this patient support herself financially? What is her occupation? Are there certain tasks that she does at work that may predispose her to having this hand pain? What's the living arrangement like? Does she live alone or with family? And what's the relationship with her family members? Are they supportive? You need to find out whether she has a history of smoking or history of alcohol use or use of recreational drugs. After the history taken, you need to summarize before going to physical examination. Regarding the physical examination, you first need to obtain the patient's consent to examine. Then you sanitize your hands and obtain the vital signs. After this, you do a general examination. On physical examination, you want to start by inspecting the hands, looking for any swelling, erythema, atrophy of the thenar or hypothenar muscles, looking for any deformities or scars. Also need to inspect the nails for any nail changes. On palpation, you need to palpate the hands, checking for temperature to see if it's normal. Also, you need to check for tenderness. For tenderness, you need to palpate the distal radial bone, the distal ulnar bone, the styloid process, the base of the thumb, the carpal bones, and the metacarpal bones. Next, you need to do the range of motion, flexion and extension of the wrist, and also ask the patient to do some thumb movements. You ask the patient to use the thumb to touch the base of the little finger and also the tips of all the fingers. You also assess the power by asking the patient to do the same movements, but this time against resistance. Next, you want to do a sensory examination using a cotton tip and working along the distribution of the median nerve. If carpal tunnel syndrome is suspected, there are some special tests that can be carried out. In the Phalen's test, the patient puts the back of the hands together and bends the wrist for 1 minute. If this test is positive, the patient feels tingling sensations or numbness in the fingers within 1 minute. For the Tinel sign, the doctor taps the median nerve at the wrist. If this test is positive, the patient experiences tingling in the fingers. For the carpal compression test, the doctor holds the patient's wrist in slight flexion and directly compresses the median nerve by applying pressure to the proximal wrist crease for about 30 seconds. If this test is positive, the patient develops pain or numbness in the region of distribution of the median nerve. For the hand elevation test, the patient holds their hands above their head for about 2 minutes. If this test is positive, the patient experiences pain or numbness within the 2 minutes. Investigations that can be carried out include an X-ray of the wrist, which will help to rule out fractures or arthritis. Electromyography and nerve conduction studies may be used to confirm the diagnosis of carpal tunnel syndrome. Treatment for carpal tunnel syndrome should begin as early as possible. If there are any underlying conditions such as diabetes, this should be treated first. Non-surgical treatments include wearing a splint, which is usually worn at night. The patient can also be advised on lifestyle changes, such as avoiding activities that may provoke the symptoms, and also be advised on the option of job modification. Patient may also be prescribed non-steroidal anti-inflammatory drugs or steroid injection. For surgery, carpal tunnel release surgery is the most common surgical procedure for carpal tunnel syndrome. I hope you enjoyed this presentation. Thank you for listening, and I wish you all the best.